All right, welcome back. This is Chapter 9, Lecture 3. We're going to finish this up. It's going to be focus slides number 93 through 126. We're going to discuss immune deficiencies and also disease processes and how they manifest themselves. When we talk about immune deficiencies, immunodeficiency is an abnormal condition in which part of the immune system is malfunctioning or not working or inadequate. You have congenital immunodeficiencies, which is a defects that involve the lymphoid stem cells and affects both the T and the B cells. Both forms of the disease are inherited. They're usually X-linked. XLA are one of the most common forms of inherited primary immunodeficiency and occurs predominantly in males. Bottom line, all this results in a decreased level of all immunoglobulins and mature B lymphocytes being produced. It also decreases the ability to produce antibodies and decreases the ability effectively to protect ourselves against bacteria and other viruses. Acquired immunodeficiencies, there's some contributors: nutritional deficiency, stresses of trauma, hyperperfusion or shock, mediator production, and then damage to vital organs and decreased nutrition. Also, intragenic treatment-induced immunodeficiency. Often therapeutic benefit that we do this. It may lead to other diseases, though. Physicians are usually very cautious about prescribing that therapy where they're weakening the immune system. And then you have a lot of different types of idiosyncratic reactions to those antibodies, which may cause bone marrow suppression. Physical and mental stress goes along with this, and it also decreases the white blood cells and lymphocyte productions. And then you have acquired immunodeficiency syndrome, or AIDS, because of the HIV virus. If you have the HIV virus, it may move to acquired immune deficiency syndrome. Treatment of immunodeficiency, basically replacement therapy for some types. You can use intravenous gamma globulins. It's used in a number of patients with immunological disorders of the nervous system, bone marrow transplantation, and then also transfusions. Factors that can cause disease: genetic, environmental, anatomic, and immunologic. Genetic factors are present throughout birth and are passed through one person's gene to future generations. Obviously, environmental factors include any microorganisms that you may come into contact with. Anatomic causes include malrotation of the colon, degenerative diseases of the spine, and aortic stenosis. And as far as an immunological reaction, it can cause disease. An example is an agent that triggers an abnormal immune response against myelin, leading to the development of multiple sclerosis. Factors: continued, uncontrollable, and controllable. Obviously, uncontrollable, you can't do much about your genetics. You can't do anything about your race. It's who you're born. Otherwise, there are controllable ones: smoking, drinking alcohol, making sure we have good nutrition, good physical activity, and reduction of stress. Age-related risk: newborns, teenagers, older adults. Newborns are at risk because their immune system is not fully developed. Teenagers are at risk because of the injury due to trauma and the use of drugs or alcohol. Older adults have a risk of cancer, heart disease, and those kind of things. Sex-associated factors. Sometimes sex is related to the risk of having certain diseases, obviously. Presentation of the disease can differ from men to women. Genetic disorders are also related to a person's sex when the defective gene is located on a sex chromosome. Causal risk factors that cause disease, obviously. Non-causal risk factors they can cause as well. All studies should be considered to the incidence and prevalence of morbidity and mortality of the disease. Incidence is the number of new cases. Prevalence is the number of cases in a particular population. Morbidity is obviously the presence of a disease or incidence and the prevalence of that disease, and mortality is the number of deaths caused by it. So we need to monitor these things. This table shows you the interplay of the various risk factors. Various risk factors in respiratory disease. Okay, common familial diseases: genetic risk, familial tendency. Genetic risk is one that passed through generations. Familial tendency is a cluster of diseases and family groups. Autosomal recessive is a pattern of inheritance that involves genes located on autosomes. A person needs to inherit 2 copies of that particular gene in order for it to pass through. And then autosomal dominant, a person needs only to inherit 1 copy of the particular form of gene that shows that trait. Immunological disorders caused by either hyperactivity or hypoactivity of the immune system. Most exhibit familial type of tendencies involving overactive immune systems such as allergens, asthma, rheumatic fever, those kind of things. And then allergies acquired following initial exposure to an allergen, repeated exposures that cause the immune system to react. This figure shows the pathogenesis of an allergy. It's a pretty good one. It's on slide 104. Cancer. It's a pathology that describes and associated with malignant growths. The malignant growths are called neoplasms in various anatomic areas of the human body. Prognosis often depends on the spread or the metastasis and the effectiveness of the treatment. Lung cancer, which is a major risk of cigarette smoking. 8 alterations in genetic material of lung cancer that may suggest a genetic tendency. Other predisposing factors include exposure to asbestos, coal products, and other industrial and chemical products. Some of the symptoms include cough, difficulty breathing, blood-tinged sputum, and repeated infections. Treatment depends on the type of cancer and the location of that cancer. It may include surgery, chemotherapy, or radiation therapy. Cancer of the breast is most common cancer in women. Women whose first degree relatives have breast cancer are 2 to 2.1 times more likely to develop disease. The risk varies with the age which the affected relative was diagnosed. About 5 to 10% of the patients have some kind of pattern of autosomal dominant inheritance. Symptoms, usually early. They're a small painless lump, thick or dimpled skin, change in the nipple itself. Late would be a nipple discharge, pain or swollen lymph glands in the axilla. Treatment depends on the location and the size and obviously the metastasis of the tumor. Colorectal cancer is the third most common type of cancer in both males and females. Relatives of patients with colorectal cancer are more likely to have the disease themselves. Symptoms may be minimal, small amounts of blood in the stool. Treatment involves surgery and sometimes chemotherapy. Endocrine disorders. Diabetes mellitus is a chronic disorder of metabolism. You have ketoacidosis, which is type 1. This is your insulin-dependent patient. And then non-ketoacidosis, which is your type 2, which is your non-insulin dependent patient. Hematological disorders, that's a common familiar disease, a few of them here, hemolytic anemia, hemophilia, and hemochromatosis. These are characterized by the increased destruction of the cells themselves, specifically the red blood cells. There's a number of causes: Rh factor blood transfusion reaction, disorder of the immune system, exposure to bacterial toxins or chemicals. Hemophilia is inherited. It's an inherited disorder characterized by excessive bleeding. It has a sex-linked condition. It's only occurring only in males. It's passed from asymptomatic mothers to sons. One of the blood clotting proteins is missing or present in abnormally low amounts. Hemochromatosis, it's inherited. It's an autosomal recessive. It's a disease in which the body absorbs more iron than it needs. Okay, this figure shows iron uptake, transport, storage, and utilization for hemoglobin synthesis. Cardiovascular disorders, long QT syndrome, cardiac conduction system abnormality. It's a prolongation of the QT interval of the electrocardiogram. It's inherited in an autosomal dominant manner, sometimes associated with congenital hearing loss, hypertrophic cardiac myopathy, or mitral valve prolapse. Most patients are asymptomatic until they have a dysrhythmia causing syncope or sudden death. Considering syncope, it's considered syncope to be kind of like due to a life threat until proven otherwise kind of a problem under the following conditions. If you have syncope exercise-induced, syncope associated with chest pain, syncope history in a close family member, or syncope association when you get startled all of a sudden. So these are considered a life threat if you have any of those conditions. Cardiovascular disorders, cardiomyopathy disease of the myocardium that ultimately progresses to heart failure and acute MI or AMI. Heart muscle becomes thin, flabby, dilated, or enlarged, and then you get a hypertrophic cardiac myopathy, which is genetically autosomal dominant. It's an excessive thickening of the heart muscle itself. Symptoms may include shortness of breath, chest pain, palpitations, or syncope, or sudden cardiac death is also possible. Treatment includes beta blockers in some cases, or surgery, or an autonomic implantable cardiac defibrillator. Other things: mitral valve prolapse, mitral valve leaflets balloon into the left atrium during a systole, often benign and asymptomatic. Nobody really figures them out until later. It's only upon physical finding there may be a clicking kind of sound during cardiac auscultation. It may lead to mitral valve regurgitation, where large amounts of blood leaks backward through the defective valve. This can lead to thickening or enlargement of the heart wall. Patients may be feeling tired, short of breath, those kind of things. Treatment can be medication, in some cases surgery to replace the valve. Coronary heart disease is typically from occluded coronary arteries that are that have arteriosclerotic type of plaque, build up. This is a familial tendency, so it runs in the family. Other risk factors include hypercholesteremia, cigarette smoking, hypertension, age, and diabetes. Hypercholesteremia is obviously elevation of blood cholesterol levels. Hypertension, associated with a high risk of coronary artery disease and stroke. Risk factors can be genetic or lifestyle related. They include age, race, obesity, or being plain and simply overweight. A sedentary type of lifestyle, tobacco use, diet, and stress. Stroke risk factors are also genetic and lifestyle related. Include age 55 or older, race African American, Hispanics, American, Indian, Alaskan Natives, sex primarily men, family history, obesity, being overweight, hypertension, high cholesterol, tobacco use, diabetes, those kind of things. So a lot of stuff can cause strokes. We need to be able to understand the difference between the ones we can control and the ones that we can't, and accept the ones that we can't, and start working on the ones that we can control to prevent stroke. Renal disorders. Common renal disorders: gout, abnormal accumulation of uric acid due to a defect in metabolism. It accumulates in the blood, the joints, causing pain, more common among men. Left untreated, it causes destructive tissue. Kidney stones. This photograph is a kidney stone. Holy smokes, that's over 5 centimeter stone. Usually they're small masses of uric acid or calcium salts that form in any part of the urinary system. Often they cause a lot of pain, maybe even blood upon urination. Researchers have also got some genetic links to it. Uric acid stones often have a genetic basis to that. Usually you can pass them, or they can be destroyed through ultrasound. You can have a big sonic boom. You can get into the ultrasound tank, and they boom you with high intensity sound waves to break them apart so you can urinate them out. It's still going to hurt. All right, gastrointestinal order, malabsorption, to include lactose intolerance, pet folks, ulcerative colitis, and Crohn's disease. Other stuff: peptic ulcer disease, gallstones, and then specific obesities. It's unhealthy accumulation of body fat. You have morbid obesity, where body mass index, or BMI, is greater than 40 kilograms per mass squared. Overweight is a BMI of 25 to 29.9. Always good to keep an eye on that. Some of the neuromuscular disorders: Huntington's disease, muscular dystrophy, multiple sclerosis, and Alzheimer's disease. These are common familial type of diseases. Some psychiatric disorders or familial disease orders. If it runs in the family, it very well might strike you. Group of mental disorders for schizophrenia. Usually these are characterized by gross distortions of reality, psychosis, withdrawals from social contacts, and disturbances of thought, language, perception, and emotional response. Symptoms are very wide and varied. They just need to be very specifically diagnosed and treated. Bipolar disorder: it's a mental disorder characterized by episodes of mania and depression. There's a lot of evidence in the role of genetics when it comes to bipolar disorder. Treatments consist of psychotherapy plus antidepressants and tranquilizers. Stress and disease. Stress is the medical term for a wide range of strong external stimuli that can cause a physiological response. Physiological stress is a change that makes it necessary for the cells of the body to adapt. Three concepts of stressors, its effects, and the body response. Usually response to stress is appropriate and beneficial, at least it should be. Unchecked stress response can also result in problems, which could lead to chemical dependency, heart attack, stroke, depression, headache, abdominal pain, and so on and so forth. Okay, so general adaptation syndrome. This was identified by Hans Seal in the 1920s. It's characterized by a three-stage reaction to stressor. The stage one is alarm. Body reacts by releasing catecholamines. Catecholamines activate the sympathetic nervous system. These effects can include increased respiratory rate, decreased blood flow to the skin, also smooth muscle contraction, and it also has very specific reactions in the liver as well. You got to remember that adrenaline and noradrenaline are your primary neurotransmitters. Adrenaline acts as a neurotransmitter. The noradrenaline is the neurotransmitter of the primary neurotransmitter of the peripheral systemic nervous system. And the catecholamines activate the sympathetic system by binding to the receptor sites, both alpha and beta. Alpha receptor activation results in vasoconstriction, and beta receptor activation results in increased heart rate, increased force of contraction, and increases conduction velocity. Other effects include increased respiratory rate, decreased blood flow to the skin, smooth muscle constriction, and various effects on the liver to increase the body's use of glucose. Stage 2, resistance. The adrenal gland releases two different types of hormones. It's the body's way of adapting to stressors. It stimulates the adrenal gland to secrete corticosteroid hormones that increase blood glucose level and to maintain blood pressure. Glucocorticoids and mineralocorticoids are what is released, what is stimulated and released. Continue on the hypothalamus. It stimulates the anterior pituitary gland to release adrenocorticoid hormone, or the ACTH. ACTH targets the adrenal cortex. What happens when you target the adrenal cortex is it stimulates the cells to start doing more energy production, and then it increases your serum glucose levels and impairs the use of glucose by peripheral tissues. And it also decreases protein reserves and prevents the mobilization of fatty acids, and it reduces inflammation when it served its purpose. It also increases red blood cell productions and affects all your electrolyte levels. Stage 3, exhaustion. The adrenal glands are depleted and they're decreasing the level of blood glucose. This results in decreased stress tolerance, progressive mental and physical exhaustion, illness, collapse, and the body's immune system begin to be compromised. Effects of chronic stress. Hypothalamic pituitary adrenal axis, which is the major part of the neuroendocrine system that controls all of our reactions to stress. This triggers a set of interactions among glands, hormones, and parts of the midbrain that mediate the general adaptation syndrome. If we have continued stress, it will lead to loss of these normal control mechanisms. Eventually they will fail because they're wore out. Continued production of cortisol exhausts the stress mechanism and leads to fatigue and depression. Consistently high levels lead to suppression of the immune system as well. So it kind of destroys us in our own internal sense. We cannot have chronic stress forever and ever. Alright, so stress and depression have a negative effect on our immune system. It causes the body to lose its ability to fight disease. It encourages the body to release fat and cholesterol into the bloodstream, eventually causing a heart attack or a stroke. Related conditions include depression, headache, insomnia, ulcers, diuresis, acne, diabetes mellitus, rheumatoid arthritis, and asthma. Coping mechanisms, they play a major role in the psychological response to stress. Our healthy persons may manage stress with very little impact, on the immune system. Patients with ineffective coping mechanisms will have problems. They'll have deleterious effects on the immune system itself. The effects are worse on a person with an already compromised immune system. Immune suppression can be corrected with psychotherapy, medication, and other positive influences. All right, folks, that was the last slide of pathophysiology. I hope you enjoyed it. Very long lecture, a lot of stuff to think about, a lot of stuff to remember. Go ahead and clock out now and clock into virtual time clock. Clock out of virtual time clock and then clock back in and take test number 3 of Chapter 9. That's test 3 of Chapter 9. And again, thank you for watching this, and we'll see you next time.